Carrie joins us from Colorado State University, where she is currently a postdoctoral scholar. Before to Carrie completed her doctoral work at Purdue University with Maggie O'Hare. And to my knowledge, I think one of the things that's unique about Carrie is that Carrie was the first person at Purdue, I think possibly the first person in the entire country to receive a PhD specifically on human-animal interaction. So her certificate is PhD in human-animal interaction, and I know nobody else who has done that. So that's really cool. And Carrie and I have actually known her for a really long time. We met when Carrie was an undergraduate at Duke University. I was there as a graduate student at the time, and we were both actually working on non-human primates when we first met. But we later collaborated on studies with detection dogs and service dogs. Then Carrie often did a master's at St. Andrews before coming back to the States for her graduate work at Purdue. And I was lucky to serve on Carrie's doctoral committee when she was at Purdue. And I have this very distinct memory of Carrie sending her dissertation proposal to the committee. And I see this proposal and it has like nine proposed articles as a part of the dissertation. And I saw this and I was like, this is insane. Nobody can do this. And help Carrie whittle this down. But then I thought, well, probably if there's one person in the world who can do this, it's Carrie. And it was. She did all of this. She's been just prolific, and you know, a quick look at her CV shows how successful she's been in terms of publishing and bringing in funding for her research. She's worked on all kinds of fascinating topics, and today is going to tell us a little bit about her work on post-traumatic service dogs for military veterans. So it's my pleasure to introduce Carrie and hand things off to her.
Thank you, Evan. That was wonderful. Introduction. Yeah, as Evan said, I am a human interaction researcher, so all my research gets to focus on our relationship with animals. It's a wonderful field to do research in, and a lot of my research, as Evan said, is focused on service dogs. And all my dissertation research focused on PTSD service dogs as one little type of service dog to study, and really understanding what PTSD service dogs are, what they specifically do for veterans, and most importantly, are they effective at treating PTSD and helping veterans' quality of life? So this is research I did with collaboration with Dr. Maggie O'Hare at Purdue University, which I'll reference throughout the presentation. So I think everyone probably knows to an extent that PTSD affects many of our military veterans. PTSD, if you're not aware of the term, stands for post-traumatic stress disorder. It's a psychiatric disorder that can occur after any traumatic event, not just veterans. It can occur after things like sexual or physical abuse, experiencing a national disaster, being in a car crash, a lot of different types of trauma. But combat is a particular salient stressor, and a lot of our veterans return with symptoms of post-traumatic stress, particularly those that were deployed to Iraq and Afghanistan with pretty combat-heavy deployments. Actually, about 1 in 5 will return from these deployments with PTSD, so about 20%, which is a pretty staggering number of veterans. Unfortunately, PTSD is difficult to treat. There is no cure for PTSD, and it can often be a lifelong disorder, especially when there's comorbidities involved, such as depression and substance abuse and traumatic brain injuries. First of all, it's well known that not a lot of military veterans, not all of them at least, will seek out mental health treatment for a number of reasons, including stigma surrounding mental health problems and access to care. Of those who do seek out treatment, there's pretty high dropout rates, again, for a variety of reasons. And then those who do complete treatment, there's a pretty high rate of retaining symptoms. So oftentimes, even the most effective treatments will help PTSD symptoms and decrease the severity, but the diagnosis will still remain. So the overall take-home message is that our effective treatments, which are largely medications and different types of psychotherapies, are effective for some and not all. And a lot of veterans will seek out complementary or alternative interventions to help with their daily symptoms, in addition to those treatments that they're receiving elsewhere. Of course, one of these complementary treatment options, the focus of today's talk are these cute service dogs. They come in all different shapes, size, and colors. You might have seen a PTSD service dog out in public, or you might know someone who has one of these service dogs. And if you're not familiar with the term service dog, these dogs are specifically trained to perform tasks or work that is directly related to disability. And you might be more familiar with kind of the service dogs for physical disabilities, whether that's a guide dog for someone with a visual impairment, a hearing dog for someone with a hearing impairment, or those that help with mobility if someone has a spinal cord injury or some sort of physical disability. However, these are psychiatric service dogs where the disability is mental rather than physical. So it can often be hard to identify that someone with an invisible disability like PTSD needs a service dog. And so that's one of the big things I have to point out are these are viable service dogs. They are helping a disability. They're not emotional support dogs or pet dogs because they're specifically task trained to help PTSD symptoms. So you might be wondering, what could you train a dog to do to help PTSD? So there's quite a different number of tasks that they can be trained to do. One common one is that dogs can be trained to use their body weight as a grounding mechanism to help reduce veterans' anxiety or panic. And so they can lay on or on top of or in the lap of a veteran and help them ground themselves, especially when experiencing a panic attack or an anxiety attack. Dogs can also be trained to provide what we call tactile interruption, which is nudging with their nose or pawing or licking the veteran, and can actually alert them when they are having anxiety and then also respond to that anxiety. So helping the veteran be present in the moment and really help calm them down. And they can do this at night as well, and by actually alerting to it and responding to nightmares. They could also help reduce hypervigilance, which is one of the big symptoms of PTSD. It basically means always being vigilant or on alert and kind of anxious, especially in public. And so the dogs can be trained to position behind the veteran and quote unquote watch their back, which anecdotally helps veterans feel a little bit more secure, especially out in public. And then they can also help with crowding by actually helping provide personal space and situating in front of the veteran to, again, help with that crowd anxiety. So those are just some of the tasks that are being trained for PTSD service dogs. We also know from just decades of research that just simple pet dog ownership is beneficial. So there's a lot of untrained things that are happening as well that I like to remind people of. So having a dog in general is great for PTSD in terms of instilling a sense of routine, promoting responsibility and self-efficacy. Of course, promoting exercise, that's a big one when you have to walk your dog. And then just helping the veteran overall joy and mood and happiness by having this battle buddy or this companion with them all the time. So we know that something beneficial is happening with PTSD service dogs because they are incredibly popular and increasingly so. As of 2014, probably even more now, psychiatric service dogs for PTSD are the third most commonly placed assistance dogs in the United States and Canada. And to evidence that there is something beneficial happening, there are tons of these wonderful nonprofit organizations whose entire mission it is to provide trained service dogs specifically for military veterans with PTSD. And the wait lists for these organizations are very long. They can be months to years long. So that we know that there's a demand for this practice. And there's definitely a lot of popularity in terms of media coverage and kind of popularizing PTSD service dogs in news articles and on the internet. So a big surge in placement. However, we have not seen that big surge in research to accompany placements. Research has been pretty lacking, and we have a lot of anecdotal reports and great stories, but not a lot of clinical research on the level of what we would do for medications or for psychotherapy for PTSD. And so the VA has been pretty strong in their standpoint that there's some preliminary research, but there's not enough research to know if dogs can help treat PTSD. We need evidence-based therapy medication for PTSD, and it's difficult to draw strong conclusions on the few studies that have been done. So there's overall a big need for clinical empirical research really quantifying the effect that these dogs are having on veterans. You might be asking, if we already know that dogs are beneficial, we have a lot of veterans and spouses and mental health providers saying that these are doing great things, why do we need to necessarily spend all this time and money quantifying it? So great question, thought you'd never ask. So research is incredibly important for a lot of reasons. So one of the big reasons, like I just said, these nonprofit organizations can't accommodate all veterans that apply. The wait lists are super long and funding is limited. So service dogs, when you really count up all the funds needed to breed them, raise them, train them, and then care for them for their lifetimes, it's pretty expensive. So research can help get more resources toward these organizations. We also need quite a bit of evidence-based research to set expectations for clinicians. Getting a service dog is actually a pretty big commitment. It's a multi-year long endeavor, right? And there's currently little empirical evidence about how the dog is going to be benefiting or maybe hindering the veteran's life. So research is really needed to set those expectations for veterans and their spouses and their families, and for healthcare providers and mental professionals who veterans are coming to and asking, should I get a service dog? And they have no research studies to cite. We also need research, of course, to inform policy and help public support. So to be able to make sure that PTSD service dogs and psychiatric service dogs as a whole are taken seriously and allowed on airplanes and in public, and to help prevent service dog fraud. And then one of the most important questions is efficacy. So research is needed to ask really important questions like, what kind of veteran will benefit the most from service dogs? What type of dog personality or temperament is the best? And what tasks should we be training? And which are the most helpful and which are the most used? So those kind of reasoning and questions guided the reason for my PhD research, and our overall research goal was to put some strong empirical evidence behind this field and to quantify the advocacy and role of psychiatric service dogs for military veterans with PTSD. And we did this with an organization called K9s For Warriors. So we didn't train and place the service dogs as researchers. We teamed up with them, who are a nonprofit service dog provider here in the United States. And they're actually one of the largest providers of PTSD service dogs for veterans in the country. So we teamed up with them and formed a collaboration to essentially evaluate their program in a research-based model. And we did this with many different studies. I'm going to largely talk about our preliminary efficacy study, as well as quickly go over another study we did to kind of define what PTSD service dogs are doing. And then I'll end with talking about what we've been working on for a long, long time, which is our big randomized clinical trial on this topic. But before I get started on this study, I wanted to just quickly tell you more about K9s For Warriors. So they are a nonprofit organization, like I said, meaning that they don't charge for service dogs. The service dogs are provided free of cost to the veteran. They largely get funding from private donations and fundraising. And one of their really interesting aspects of this organization is that they, a lot of their dogs, actually the majority of the dogs come from rescue shelters. So they don't necessarily follow a breeding model. They're rescuing a lot of their dogs. And so their mission is kind of save a dog life and then save a veteran's life as well. And this is just a quick overview of the process. Dogs are going through about 6 to 8 months of training to become a PTSD service dog. Veterans apply at that time. The wait list is anywhere between like a year or 2 years long, depending on the time. They are matched with a service dog based on their needs. So they really take pride in kind of matching the personalities of the veteran, the dog, and their overall physical needs. And then they provide customized training after that placement over the course of the partnership. Okay, so starting off with our first big study, where we wanted to really quantify the efficacy of these service dogs. So we recruited 141 veterans from this first study. All of them had already applied for and been approved for getting a service dog from K9s For Warriors. And about half of them already had a service dog. And the other half was on the wait list receiving usual care. So that was our control group. We had 75 with the service dog that had their dog for 1.6 years on average, and 6 on the wait list who had been on the wait list for a little over half a year on average. But again, these are just averages, so keep in mind this is a range. And our sample was a very typical veteran sample, largely white identifying, largely male identifying, and about 37 years old. So what did we measure? We measured self-reported mental health and quality of life through standardized questionnaires. And we made sure to use questionnaires that were largely used in other PTSD studies to be able to compare across trials. And then we also collected biological samples to really hone in on objective well-being as well. So our questionnaires, we had a big online research study. We never had veterans actually come to Purdue University. They were in their homes. So this was all done remotely. So they did this online questionnaire at home, and we measured lots of different things with 23 different instruments, of course, mental health, social functioning, quality of life, sleep, you name it, we measured it. And then we also took biological samples, and we honed in on the hormone called cortisol, which is our stress response system output. So you probably have heard of cortisol. It's typically when we release it, we're stressed. However, we focused on not necessarily that short-term cortisol. We focused on something a little bit different, which is called the cortisol awakening response. So if you are not aware, you now are aware that every morning when you wake up, you actually have a rise in cortisol. And a typical person, a healthy person, has a rise in the morning. And with PTSD, we often see a dysregulated cortisol awakening response. I won't get too into this because I'm sure I'm already boring you. But essentially, we wanted to quantify this cortisol response, which is more indicative of chronic stress than acute stress. So we had veterans take saliva samples from when they woke up to 30 minutes later to quantify this rise in cortisol across 2 days of their lives. And like I said, they were all at home. So we had them spit into tubes for us. And they did this when they woke up in the morning and put them in their freezer and shipped it to us at Purdue University. So this is what that looks like. One of our veterans modeling for us. They wake up, they spit into these tubes for us, and they store the samples and send it to us. So the great thing about cortisol is that it used to be taken from urine and blood, and now we can really reliably get it from saliva. So very easy for veterans to collect and easy for us to process as well. Okay, so what did we find? So starting off with the questionnaires. Our first outcome, of course, is PTSD symptoms. And we found that compared to the wait list, those of the service dog had significantly lower PTSD symptom severity. And all of these results are after controlling for covariates, demographic covariates. So this is controlling for age, gender identity, employment, and relationship status. So what we found was that those of the service dog had lower PTSD symptom severity. However, the cutoff for a PTSD diagnosis on this scale, which is the gold standard way to measure PTSD symptoms, is 50. So we found that those of the service dog had average scores that were not below the diagnostic cutoff, similar to other treatments, like I mentioned in the beginning. So service dogs, not a cure for PTSD, but significantly reducing symptom severity. We also found that compared to the wait list, those of the service dog had better mental health overall. They self-reported less depression symptoms, they self-reported less anger symptoms, and less anxiety symptoms. We also focused on quantifying kind of the good things rather than all the bad things. So we asked about well-being, and we found that those of the service dog reported more positive mood throughout the day. They reported higher life satisfaction, and they reported more resilience to overall stress. We also wanted to look at their social functioning. So the way that the dog is helping their overall relationships and social health. We found that those of the service dog were less socially isolated than those on the wait list, and that they were participating in more social activities. So this is really interesting and actually helps situate a lot of the anecdotes we have from this field. This is a picture of one of the veterans who took this picture. His wife took this picture of the first time that he was able to comfortably go into a grocery store for years. That was one of his big anxiety triggers, and he was able to go grocery shopping with his service dog's help with his anxiety, and that's a really big deal. And even though that's not necessarily social in this context, it is getting out of the house. And this translates to overall just being more social, going to your son's soccer game, being able to go to a restaurant with your family, or being able to leave the house in general is a big step. A couple of areas we did not find an effect. One of the areas we did not find an effect of the service dog was on overall sleep quality. So no difference in overall subjective sleep quality here. But we broke it down into component scores, and we did find two areas where service dogs are having an effect. So those of the service dog had better subjective sleep quality, lower is better here, and also lower daytime dysfunction. So they said that they might have been sleeping better and feeling less tired throughout the day, but no difference in how long they slept, how efficient they slept, their disturbances, or their sleep medications. And we also found that those of the service dog did not report any differences in their family lives, which is another interesting finding. So we asked all veterans to report on their overall family functioning, and we found no difference across groups here. Among those that were married or cohabitating with a significant other, we found no difference in their relationship satisfaction either. And so this was actually a really interesting finding that our colleague Christine McCall published and really honed into, looking at how potentially service dogs were adding to relationship strain and not necessarily uniformly benefiting these family lives. If you think about it, military spouses are pretty subject to some intense stress and caregiver strain. And the service dog is just one more thing to worry about. And we find that some spouses really, really benefit, and some spouses experience some strain, some jealousy, and some negative effects. So that was one thing where we thought we would find an effect and didn't. And I love doing this research because there's always some sort of surprise. And service dogs and dogs aren't magic. And that's one thing to really keep in mind and to remember. And then for our biological samples, we found that those of the service dog had significantly higher cortisol awakening responses, which is a good thing. So a little bit different than that short-term cortisol. It means that they are more normal or less blunted. So if you are a cortisol nerd and want to get into it, please read this paper. I'm not going to bore you guys and talk about cortisol anymore, but it is all laid out in this paper. Okay, so overall, we found preliminary evidence in service dogs as an effective complementary treatment for PTSD. We found evidence that they were associated with better mental health, quality of life, and psychological well-being, as well as better social health. We found potential physiological changes to the stress response system. A couple areas where we identified a service dog may not impact as well. And overall, this really set the stage for more research. So of course, this was a cross-sectional study. We only measured veterans at one time point. We didn't follow them over time. So we just looked at everyone with a service dog compared to everyone with the wait list. So it's pretty limited. It's definitely a pilot study, right? It gives us a little bit of information, but we don't know where they started before they got a service dog, and we don't necessarily have them all at the same time points. So some had their service dogs for longer, some had them for shorter. So it was kind of we have some data, but we need a lot more. That set up our clinical trial, which we started shortly after, but we also, before we started the clinical trial, tried to quickly define the intervention to make sure that we knew the active ingredients. It's a little bit different than giving a 10 milligram pill, right? So we wanted to really look at what the intervention is before we did a randomized clinical trial on it, to quantify what kind of day-to-day use veterans are getting from their service dogs in terms of the trained tasks and the overall importance of the tasks. I won't go too into this study. I'm just going to give you kind of a very, very quick overview. But our goal was to define use of all of the service dogs trained tasks in terms of how frequently veterans are using them on an average day, what's more important, what's less important, and then the use of task over time. We also wanted to look at how tasks related to PTSD symptom severity. So if you have more symptoms, are you using tasks more often? And also the bond. If you're more bonded to your service dog, are you using tasks differently? And we also looked at some untrained behaviors, things like adding a sense of routine and having companionship and a source of love, and looked at how those are also helping PTSD. And looked at PTSD symptoms, and yeah, lots of research questions on this. So we recruited 136 veterans, again, from K9s For Warriors. Some of them were in the first study as well. Some of them, this was their first study. And they all had a service dog this time. Similar to the population, lots of males, average of 30 years old, veteran sample. And what we find was that, interestingly, overall, veterans reported using some sort of task about 3 times a day. And the most important and most often used was the dog's ability to calm and comfort to anxiety, followed by these other tasks. I won't get necessarily too in the weeds here. But overall, this helped us really kind of visualize how average use of these trained tasks is manifesting in day-to-day activities. We also found that those who had their service dogs for longer reported using trained tasks less often, indicating potentially less reliance over time, which we kind of hypothesized, but it was good to quantify. We found that PTSD severity was not a predictor of how often veterans were using tasks, nor the importance that they rated the task. So those with really severe PTSD were benefiting from their service dogs in very similar ways as those with less severe PTSD. And then the bond was actually a significant predictor of both how important the veteran rated the tasks, as well as how often they were using the trained tasks. So this was really cool data for us to be able to kind of hone in on that intervention and be able to quantify some of these things that we did not quantify in the first study. Okay, so like I said, our goal was to eventually get to this longitudinal trial, and I'll briefly talk about what that looked like. I'm sorry we don't have results to share today, but I can at least tell you all the exciting things that are coming from this big clinical trial. Importantly, this is our biggest study, and we needed a big team to be able to do this effectively. So we again worked with the K9s For Warriors. We also brought in external collaborators to help us succeed on the veteran and the dog side. So on the dog side, the wonderful Evan in this room from the Arizona Canine Cognition Center helped us really hone in on dog temperament and behavior as predictive mechanisms in the therapeutic outcomes. And then we also collaborated with the Military Family Research Institute at Purdue to really make sure that we were quantifying the veterans and their spouses in a way that was clinically making sense. Lots of team members, and we also received funding from the NIH to do this clinical trial. So it was a big project, and one that we're really excited about sharing. So like I said, the previous study was a single time point. Now we're measuring veterans over time. So we recruit and screen veterans, and they go through a baseline study period. They then have a break for 3 months where half of them receive a service dog and half of them remain on the wait list. They're still going to get a service dog, don't worry, just after we follow up with them. So they're randomized essentially to whether they do the study now or they wait. But all we're getting a service dog eventually. We had about 100 veterans that did the study. This was kind of our goal, where roughly half would be getting a service dog and half would be remaining on the wait list receiving usual care. We put in a lot more measures. So you might already have questions for me like, what about this? What about this? A lot of that was addressed in the clinical trial that we weren't able to do the first study. So we're looking at comorbidities a lot more closely now in terms of military sexual trauma and traumatic brain injury. We are really focusing on how much combat exposure and detailed deployment information to look at those individual veteran differences, and incorporating their disability ratings from the VA and really looking at how our veterans might be differentially responding. We're incorporating other PTSD treatments that they're receiving and factoring that in. So the first study kind of just assumed usual care and didn't really take that into account. Now we'll be looking at past PTSD treatment history as well as current PTSD treatments. Our outcomes are many more now, so we'll be looking at suicidal tendencies and thoughts as an outcome, looking at medication a lot more closely, and other outcomes as well. Our PTSD is now assessed with clinician assessments that are masked to treatment. So rather, the veterans will still self-report their PTSD, but rather than solely relying on that, we have clinicians who are trained to diagnose and actually screen for PTSD, come in and do a phone call with the veterans to get a little bit more of an objective level of their PTSD severity. And masked or blinded means that the clinicians don't know if they have a service dog or not, or what time point they're in. So this is really important to add that objectivity to the screening. We're taking a lot more saliva samples across more days. So looking at that cortisol awakening response much more closely now. We're also looking at sleep more closely because of those interesting findings on study 1. We're now measuring sleep objectively with a Fitbit like wristband. An actigraph is what they're called, that actually measures sleep efficiency a little bit more objectively. Veterans will also still self-report, but we're able to get how long they're sleeping and how efficient they're sleeping with these wristbands. And they wear them for 2 weeks at baseline and 2 weeks follow-up. So lots of sleep data to be able to look at there. We're also looking at real-time data collection this time. So rather than asking a veteran over the past 2 weeks, how often have you felt X, Y, and Z symptoms? We are randomly checking in with veterans several times a day and asking them, how do you feel right now? What's your mood right now? Where are you? What are you doing? And if they have a service dog, how are you interacting with their service dog? So getting a lot more of that real-time positive affect and mood, and looking at how the service dog is changing those day-to-day types of things. And then, of course, including the dogs. So we, on the clinical trial, fit all of the service dogs that were placed with a dog-like Fitbit, which is called a whistle monitor. It monitors the dog's sleep and activity as well. So this is an example of what that looks like on a pup. And so veterans wearing their wristbands and dogs wearing their collar attachments, and being able to actually ping each other through Bluetooth technology, that we can actually look at proximity between the veteran and the dog as well. So lots of data coming on the dog side. And then the most exciting part, which is where Evan McLean and the dog side comes in, is, as you can see, I already mentioned this, but there are a lot of shelter dogs, all different types of personalities, temperaments, breeds, backgrounds, etc. Some of these dogs are super food motivated, some not so much. Some have really, really high play drives, some not so much. And they're all individual, unique dogs, right? So one of the big questions is, can we quantify the individual differences of the dog's personality and temperament and be able to pair that up with the veteran's outcomes. So that is in the works as well, to really hone in on how dog differences are playing into all of our outcomes. And then I just kind of wanted to end with some really happy news. We worked so hard on this research, and it's really great to have your research mean something and be applicable to the real world. So just really happy to share with the world that as a result of our research study, as well as a couple others that have been instrumental in moving the field forward. We now have Biden and Congress signed in the PAWS Act. If you have never heard of it, it is an act that will allow the VA to do a pilot program to actually start funding service dogs for PTSD. And so it started in January, and we're super excited that our research was able to kind of push policy forward and allow more resources to get to these organizations and help more veterans at the end of the day, which is always our goal in this study. And this is just information about the PAWS Act. Oh yeah, and then the VA is going to be collecting some data off of this, and hopefully in 5-10 years, we'll have a lot more outcome data on how service dogs are treating PTSD. So a little bit of happy news to end, but I also wanted to just take a second to thank all of our funders for this research. We had a lot of great collaborators and funders to help us do this monumental research. So thank you to them. And then thank you to all of our collaborators across the studies. This research really takes a team of dog people, veteran people, psychologists, human development and family studies, relationship psychologists. It's just all over the map. And so super thankful to everyone involved that helped make these research studies a success. And that's my contact information if you want to get in touch. I'm happy to talk about all things service dogs and veterans if you have any questions. So happy to chat.
Wonderful. I think we do have some time for questions. This was a fascinating talk, Carrie. Thank you so much.
Thank you.
So I'd like to invite the audience to either post a question to the chat window or simply raise their hand, unmute themselves. Yes,
I can answer Victoria's question. So she asked, was there a distinction made between active duty and retired veterans?